emergency.
Hello, Fred Morey, one of the doctors. Welcome to the Alfred. Sorry about what's happened to you.
Jasmine's been thrown and kicked by a horse. She has dangerously low blood pressure from heavy internal bleeding.
Can you ring up Blood Bank and Hematol and tell them she needs to be cross-matched, and that is the most urgent blood picture in the hospital, okay?
Also tonight, a man is brought to the Alfred after falling from a ladder.
Standing on a ladder about 9 foot in the air, he somehow fell down onto his back.
Kevin has almost no feeling in his legs.
Okay, can you keep that leg up in the air for me? No, all right.
Delicate spinal surgery offers his only hope of ever walking again.
You may end up with a complete spinal lesion. Complete paraplegia.
In a trauma bay at the Alfred, Jasmine's abnormally low blood pressure is causing concern. She has serious internal bleeding after being thrown and trampled by a horse.
So here's her liver, here's her kidney, and that black strip in between it and all this black stuff around this lady's liver is blood.
At least one of Jasmine's internal organs has been ruptured. Doctors need to stop the hemorrhage quickly. First, though, they must find the source of the bleeding.
I mean, Jason's the surgeon. You guys need to talk about whether we go to CT or theatre. Hemoglobin's not back yet. No, it's all happened in the last 15, 20 minutes, I'm afraid.
The trauma team have broken the news to Jasmine's sister, Georgia.
But got my foot caught in the stirrup. And as I was coming off, he kicked me.
No more horses. Horses are banned. You in much pain?
Jasmine's internal injuries are dangerously unstable. Her condition could deteriorate in an instant. Doctors need to find what's causing the bleeding, but there's a complication.
Hi, please. Our surge.
We've just lost all the power and trauma.
Oops.
Down the road at the Sandringham Hospital, a young footy player's come in after a painful hit.
Just take a seat on the bed for us. So you're playing football?
Yeah. And you were injured by someone hitting your chest, is that
No,
correct?
like his body, I was leaning forward and his body sort of come through on top of mine.
Okay.
And the body of both of us has gone straight through my chest and the ground.
Right.
So my chest has smacked the ground.
Chest hit the ground.
Yeah.
Okay.
Physio checked him over and they said they think it's bruised. They just wanted a precautionary just in case.
Alrighty. Didn't hear a crack or anything?
I heard a big crack, but I think this might have been my back. Oh yeah, that's really swelling me.
In here?
Yeah.
Oh, okay. Alright, they might suspect that you might have a fractured collarbone too. Go speak to one of the docs and see if we can get you an x-ray.
Yeah, thanks.
Alright.
Thanks.
It was a pretty important year for him this year with his footy, so
You want to try and get in the firsts and play really well and try and get looked at AFL scouts.
not just for his football, but he's also doing aviation at university and he won't be able to fly because of the pressure.
I just started. I've had my second flight tomorrow on Monday, so I really enjoyed the first one. I just can't wait to get back up, but this could be a bit of a pain.
More than a pain, it could mean Michael will have to defer his course and sit out at least the next 6 weeks of the footy season. Across town, paramedics are heading to a busy intersection. A pedestrian's been run down while crossing the road at the lights.
When you head towards a job like this, you start to plan the sorts of things that you may encounter. So when you arrive, you have a look at the scene, you look at where the car is, you look at where the pedestrian is, you try and look at where the point of impact is to where the patient lands, what sort of damage is on the vehicle.
Eileen was heading back to work after her lunch break when she was hit and dragged underneath a car.
Why are you shaking? You just cold or the whole incident itself?
Yeah, a bit of both, I think.
Bit of both? Okay. And have you got any pain anywhere?
Mainly in this left leg.
Left leg.
Eileen has suffered 2 impacts. Once when she was struck by the car, and another when she hit the ground. She appears to have few external injuries, but Eileen's complaining of sharp pain in her legs and pelvis.
Just pop this in your mouth. Use your hand if you can. Yep, that's it. Lovely.
Now, what is the habit of the patient? Is there anything going on?
Back at the Alfred, a blackout has interrupted Jasmine's CT scan.
Follow Sage.
Just a bit of a blackout, Jasmine. You don't have this effect on the machinery generally, do you? You do. TV's blackout.
Jasmine needs a scan to find the source of her internal bleeding after she was thrown and kicked by a horse. No critical services are affected by the blackout. They're on uninterrupted power supplies. But for equipment like the CT scanner, a backup power system kicks in after a few moments and Jasmine's scan can resume.
Yeah, it's terrible. Huge hemorrhage in her liver, not her spleen. So it's actually the other side. So maybe it was the fall that's caused the damage. She's fallen off the horse. This lady's liver's basically split open. Just burst open. Her spleen's actually okay. So, what to do?
Okay, now this is fairly uncomfortable, okay?
Eileen was run down at a pedestrian crossing on her way back to work.
Try not to move your head.
She's
too
experiencing sharp pain and she's in shock.
much. Pain's on
Not only was Eileen struck by the car, she hit the ground heavily and was dragged along for 20 metres. Despite it all, Eileen's only complaining of pain in her legs and pelvis.
She looks like she's got off relatively scot-free at this point in time, but until they've done a full medical assessment, you can't really say.
Hopefully, the accident has left Eileen with nothing worse than memories of a frightening ordeal.
I went sort of over the bonnet, and then he still kept driving. I was getting dragged along by the car, and then someone else that was there banged on the bonnet and got him to stop. I don't think he would have stopped if he hadn't done that.
Eileen's being taken to the Alfred for more tests. Upstairs in the CT area, doctors have discovered the source of Jasmine's internal bleeding. Her liver has been split in 2, a dangerously unstable injury.
The liver's ability to cope with injury is quite remarkable. And thankfully, it has a capsule, so blood can be well contained. But it may rupture in days to come. As tissues become injured, they become softer, and it may rupture and she might bleed, and that can be very drastic.
A rupture would be life-threatening. Doctors must urgently try to stop the bleeding in Jasmine's liver. They have 2 options, a conventional operation or a less invasive procedure using a catheter.
So it's a fairly massive injury. It's to an organ that's actually that's well regenerating. It's very important, but it regenerates itself very well. Things may change, and they may change fairly drastically, unfortunately, because that capsule may rupture or you may get more bleeding and things get very tense. So there still is a possibility of you going to theatre, but we'd like to avoid that.
I'm glad that the liver regenerates. It's the only organ that does, and I'm quite happy about that.
Jasmine's daughter Jackie has rushed in from work to be by her mother's side.
Give her a kiss. Of course I'd find out.
I just wanted you to do your shift.
What's the makeup stolen?
You'll cry.
Yeah, I know you wouldn't have cried because you're an idiot.
You okay?
Me? I'm not the one with my liver in 2 pieces.
Jasmine's condition is deteriorating. She'll have to go to radiology immediately to have a catheter inserted under X-ray.
Go for it.
The procedure offers the best chance of stopping the bleeding in Jasmine's liver. Footy player Michael has come to the Sandringham after being on the receiving end of a hard tackle.
Pretty quick.
So did the girls put
If Michael has a fracture, it'll delay his hopes of making the AFL draft.
So that clavicle's fine, yeah, okay. Let's do the sternum now, the middle breastplate bone.
Yeah, it's sore. Yeah.
Is it sore there or sore somewhere else when I touch
Yeah, it's like you're pushing here, but it's pushing like pains
across of it? Okay.
Yeah. Yeah, right there.
Stop. Well, he seems to have had a direct impact, ground with weight on top of him, very forcefully. So I'm a little concerned how his right clavicle, where it joins in with the sternoclavicular joint, whether that's been disrupted, whether he may have broken the end of that clavicle, the sort of the middle end. Really important to check that nothing's punctured into his lungs and his lung fields are nice and clear and air's moving well. He's not short of breath, quite comfortable at rest. All right, we'll get some painkillers for you, get an x-ray.
Yep.
See what's going on, see whether you've fractured anything.
Yep. Okay. Hold still. Good. Breathe away.
The orthopaedic surgeon has to come here and have a look. They have to check this, so he'll be at least 6 weeks out of football, they say.
Yeah, it's a bit annoying. Yeah. If it's actually broken, it will be.
This is Harry. Passes perfectly every single time. That's his trick. We're Red's Head. We just do loans for the self-employed. Red's Head. One trick. Great trick, though.
Imagine what you could be buying instead.
Unlock the power of nature with Naturopathica Phytoactive Horny Goatweed. With plant-derived horny goatweed to enhance libido and desire. Get your motor running with Naturopathica Phytoactives. Unlock the power of nature with Naturopathica Phytoactive Horny Goatweed for her. With plant-derived horny goatweed to enhance libido and desire. Embrace your femme energy with Naturopathica Phytoactives.
When you choose Cineat, you'll benefit from one supplier for all your needs, one trusted system solution, one point of contact, one warranty for all products, one industry-leading blueprint technical manual. Cineat, the one.
Maud found herself here, then here, here. Then Maud really found herself. Yes, Maud found a whole new way to live. With homes from $525,000, maybe you could too. Lifestyle Communities. Way to live, Maud!
Down there somewhere.
This is more cave than man cave.
He went to search for a better deal on our car and home insurance. I haven't seen him since. Bernard! It's been 3 months.
Still searching, hun.
With renewal prices like these, it's no wonder.
This should shed some light. Budget Direct paid out over $1.5 billion on claims in the last 12 months. So quote with Budget Direct first.
It's sure solved with Budget Direct.
Out in the auto, the old tradie stands, grasping their tools in their long, hardy hands. Click, the shears, mates, click, click, click. Wide as a bow and our hands.
Doctors are attempting to stop the serious bleeding inside Jasmine's ruptured liver.
Jasmine, I'm just going to put some local anaesthetic in the groin here. This will sting for about 20 or 30 seconds before things go numb. Okay?
Jasmine's been given local anaesthetic before a radiologist inserts a catheter into an artery in her groin.
So we're just getting access to the femoral artery here, and then we'll put a sheath in. This allows us access to the arterial system for the duration of the procedure. What we're going to do now is just find the artery that supplies the liver.
If doctors can find the source of the bleeding, they'll attempt to block the affected blood vessels.
As there's a persisting little abnormality up there. I think we'll take our catheter up a little bit further and we'll inject a little bit of gel foam in that. It's a very good agent here for blocking arteries in a trauma setting because it's easy to use. You cut this up and it forms a sort of paste or slurry almost with the contrast, which is iodine, which is what gives us the black on the image to see inside the vessel. And so you can see that we've put that in that. That will absorb the iodine very quickly and become a gelatinous material.
The gel will help block the affected blood vessels, while the iodine acts as a dye.
Okay, so it's just going in now.
Guiding the radiologist to the exact location of the bleeding.
Okay, that's perfect. Okay, so we're finished with the arterial side. You can see that's blocked that nicely.
The hour-long procedure has been a success, but the capsule around Jasmine's liver is still at risk of rupturing.
Beginning of this procedure, her blood pressure was 100 on something. It's now 126 on 65. So her blood pressure's picked up since we've embolised that hepatic artery. So, maybe that's a good sign, but not out of the woods yet. We'll go to high dependency or ICU and we'll just watch and see.
Jasmine's still in a critical phase. She'll be under constant surveillance in intensive care to ensure the bleeding doesn't return.
Oh, a bit chilly out here.
It's a rainy afternoon in Melbourne, and the emergency team is about to treat a victim of an all-too-common accident.
Hey, mate, what's your name? Kevin. My name's Jack.
Kevin was clearing his block gutters when he slipped on a wet ladder and fell nearly 4 metres to the ground. Now he has almost no feeling in his legs.
Alright, and down, mate. That's it for the minute, okay?
Where does that hurt? In your back?
Yeah, right in the small of the back.
Right in the lower part, okay.
Okay, Kevin's 48-year-old male who was working around his house today, standing on a ladder about 9 foot in the air. Ladder slipped out from under him. He somehow fell down onto his back, complaining of pain 8 out of 10. He had function of his right leg, but just felt pins and needles in his right leg.
Yeah, that hurts too.
Okay, can you keep that leg up in the air for me?
Which one?
This one.
Lift it up.
Yeah, lift it up. Lift it up. No, all right, okay.
Kevin's response to reaction tests is confusing and inconsistent. He can move his legs, but only slightly. Kevin clearly has some form of spinal injury.
It's a little bit hodgepodge, but he's got neurological dysfunction, mainly in sensation and muscle power, more so on the right. That's the disc space in between the vertebrae. Nice little block. When you get to this one's looking a bit sad. You see, it's not a nice little block. All these vertebrae should increase in size as they go down, and that one's obviously been squashed to probably 50% of its height.
The x-rays have confirmed the worst. Kevin's back is broken.
Can you swallow okay for me?
One of his vertebrae is shattered, and it's affecting his spinal cord.
Fantastic, all right.
Just how badly his spinal cord's been injured should become clearer after a CT scan.
Hi, is that Mrs. Rattle? This is Tara, one of the nurses at the Alfred Hospital. How are you? Yeah, so we have Kevin here. He was flown in by a helicopter because he's fallen off the roof. And he looks like he's probably fractured a bone in his lower part of his back. He can move his legs, but he's got some problems with the sensation there. And we're concerned about maybe his spinal cord.
If Kevin's spinal cord has been permanently damaged, he may never walk again.
How you going there, mate? Hi. All right.
Kevin has almost no feeling in his legs after falling from a ladder. If his spinal cord has been severed, he will never walk again. One of Kevin's vertebrae is shattered. The CT scan should reveal if it's damaged his spinal cord.
And we're going down the spine. And here we go. We're getting to the money now. See that nice little hole that we were supposed to have before? You can see, trace the outline of it. It goes around here. We've got this big block of bone that's sitting in there. So that bone has been pushed from this shattered vertebrae back into the spinal canal. So that is decreased by at least 3/4 the potential space for them nerves to travel. So they're being squished to buggery, and that's what's causing his pain. Basically, that needs to be decompressed. So that fragment needs to be taken out So he'll have an operation to remove that fragment.
The nerves which carry brain signals to the lower part of Kevin's body have been distorted. Kevin is partially paralysed. If surgeons cannot remove the vertebra pressing against his spinal cord quickly, Kevin could develop complete and permanent paralysis. A surgeon breaks the devastating news.
Well, you have a severe spine injury, as you know, and we should fix this as quick as possible and open the spinal canal. One of the things is that you may end up with a complete spinal lesion, complete paraplegia, despite operating. We do everything to avoid this.
Yes, so you have to work on the worst case scenario.
Worst case scenario. Okay, so I'm trying to get everything ready to go.
Thank you for that. Appreciate your help.
No, as soon as possible. Thank you.
Hello, I'm Tara. How are you?
Yeah, Tara.
Come in. You'll have to come up and talk to his head because he can't move his neck for the minute.
Can't move a lot of things.
Yeah.
G'day.
How do you feel yourself?
Pretty poorly. Yeah, very uncomfortable. But I'm a lot better than what I was. Couldn't move anything initially. Obviously, they have to present the worst case scenarios, but the fact that you might never walk again, if something doesn't go exactly 100% right, they're too concerned to even move me to another place to have it done, so it's got to be done here. It all sounds pretty nth degree type stuff, which, you always worry about things like that, but when it hits home, it's pretty daunting.
Footy player Michael's x-rays are in, and his chances of getting back on the field anytime soon are not looking good.
Straight AP.
Yeah, can you see the clavicle along
Yeah, that's still
there?
our
There's a
best view,
fracture
isn't
line
it? Yeah.
there. He's going to need to have a broad arm sling.
Michael, in terms of what you can do, it does not need plastering. We don't strap them, we don't use elastoplast, we don't do any of that nowadays. We just support it. The most important thing is what tablets I give you for pain relief afterwards.
He's been actually very lucky with football. This is his first serious injury. So he's missed a couple of weeks last year with a bad knock to the back of the head, but before that he'd hardly missed a match ever, and he'd been playing since he was about 8.
Michael didn't have to defer his aviation course, but he did miss 6 weeks of the footy season.
But we hope it was just going to be bruised, but, that's the way it goes.
Michael's hoping to stay injury-free and make it into the AFL draft next year. Jasmine remained in hospital for more than a month, and she'll be off work for another 6. Her ruptured liver is still healing and continues to cause her intense pain. Jasmine's vowed to get back on the horse one day.
It's a good luck bloody roost. I hope it starts bringing you some luck. It was made especially for good luck.